And so earlier Dr. Latha was about to come here, but due to her very busy schedule, we had to make some changes, and the session has been now taken as online. And Dr. Latha Venkateshan ma'am is professor and principal in the College of Nursing at All India Institute of Medical Sciences, New Delhi, which is country's best medical institute with extensive academic and administrative leadership experiences. She holds multiple advanced degrees in the Bachelor's of Nursing, Master's, then her MPhil. She has done her PhD in nursing, and you can see she has done double PhD. She also holds a degree of Master's in Business Administration, specifically in the hospital management, and MSc in acupuncture. Dr. Latha is a certified in diverse professional domains such as palliative care, simulation, bioethics, lean, Sigma management, qualitative research, and biostats. She is recognized internationally as an honorary professor at the Queen's University, Northern Ireland, and was also awarded by prestigious bodies including the TL Dr. MGR Medical University, Tamil Nadu, Nurses and Midwife Council and Education Today, receiving the titles such as the Best Teacher, the Best Principal, Best Nursing Researcher, and Best Educator. She is also involved in various national and state level collaborations across academic, clinical, and professional bodies. And she is also a president of CNRS NZ and contributes significantly to quality assurance initiatives in nursing education. So with this, I hand over the stage to ma'am, and ma'am, we really welcome you, and she'll be talking on the role of nursing in achieving the sustainable development goals.
Yeah. Thank you, Dr. Pratika. Namaste, everyone. I wish I was there physically. I'd meet all of you and interact with you all. However, I would join only online. And today I am here to speak about the role of nurses in achieving sustainable development goals. So, at the end of this session, you will be able to review the SDGs and compare the SDGs between different countries. You will be able to speak about the role of nurses in achieving the SDGs and identify some of the models which will be helpful through the case studies which we are going to discuss. And of course, there is a group work which will help you to apply how nurses can contribute in achieving the SDGs. I would like to start with this slide to make India's top milk donor. Her name is Latha. She is from a small town in southern India. And over a period of 22 months, she has donated 300 liters of breast milk. And it has saved the life of 1,006 newborn babies. And she received a lot of awards at the country level because she appears to be the topmost milk donor in our country, by donating 300 liters of breast milk over a period of 22 months. How did she achieve this? Because there are many deliveries happening in India and so many mothers are breastfeeding. How come one mother could donate 300 liters of breast milk while others could not? Let us explore this case scenario. If you want to achieve any goal, it requires 3 different efforts, especially when it comes to SDG or any other targets given to us in relation to healthcare. We require personal effort. An individual has to make the effort, and the institutional effort. The institution also has to make some effort, and there should be initiative from the government. If these 3 efforts are united together, then we will be able to make the goals achievable, and this combined effect is required definitely. So in this case, what was the personal effort? The personal effort was liquid gold, that is breast milk, for premature and critically ill newborns. She had the desire to donate. And the institutional effort was human milk banks in India are developed. This supports to store the donated infant milk so that it could be given to the needed newborns. And government effort is government also supports these milk banks. And so this is how the effort of the individual, the institution and government has supported. In her case, there was an NGO. The NGO also, non-governmental organization also helped to transport the milk from her home to the hospital. So it is a combined effort. So she could donate consistently for 22 months, not for 1 or 2 months, almost 2 years. She was donating the milk every day, and total milk donation reached 300 liters. You know, the milk bank capacity, 50% of the milk bank capacity was donated by a single mother. That is noteworthy here. And she pumped the milk regularly, balancing her household duties and personal health. Because you know, family members will say, "Why do you want to donate?" And she also this expressing the breast milk requires some time. She has to spare her time to express the breast milk, and the breast milk which is being expressed at home has to be transmitted to the milk bank. So an NGO was helping, to transport the milk bank. Every day they were coming and collecting and transporting it to the milk bank. So this is how she was able to donate. And this milk bank was established to support the NAC on preterm deliveries, and the facilities for pasteurization of the milk, for cold chain storage, bacterial screening was available, and it acts as a lifeline for infants without access to their own mother's milk. And there was also family and community support. So she faced weight loss and social discouragement initially, that you are losing weight and you should not breastfeed, donate the breast milk. And her family and husband encouraged her to continue donating. And in a non-governmental organization, hospital staff also facilitated safe collection and transport. So family and community support also was helpful. And what was the impact because of this single act was her donations benefited hundreds of neonates in NICU. It reduced their risk for infection, necrotizing enterocolitis, and the mortality. It provided life-saving nourishment during these shortages. So she was recognized by Asia Book of Records and India Book of Records, and she was felicitated during the World Breastfeeding Week. Her dedication has inspired many mothers in the awareness campaigns on milk donation. So her donation accounted for 50% of the total amount collected in a year. In contrast, they collected, if you see, this happened in 23-24. But what happened in subsequent years? They have collected only 192 liters from 639 donors. While it was While it was 288 liters from 727 donors. See, and you also should note that 10 to 15% of milk is discarded during screening for bacterial contamination. So where one mother could donate 300 liters, subsequent year they could collect only 192 liters from 639 donors and 288 liters from 727 liters in 2024. But then in 2023, this mother has donated so much of milk. So where did we fail? So we have to look at the individual effort, the institutional effort, and the support from family and community and the governmental initiatives, so that we will be able to promote these kind of initiatives. So somewhere the growth which was achieved is not sustained. So for sustaining it, we have to examine, getting some successes, the initiative floating is very easy. But then how we are able to sustain it? In 2023, you collected 300 liters from one mother, whereas subsequently from so many mothers, they could collect only lesser than that. So where do we fail? So success stories are shared, but sustaining the success stories are also very important. So with this introduction, we have to understand